Hi, I'm Dr. Janelle Louis. I'm a psychiatric nurse practitioner and a licensed naturopathic doctor with 9 years of combined experience in integrative psychiatry. But more importantly, I'm someone who knows firsthand how difficult it can be to find the right kind of mental health care. My passion for this work started with my mom's story. Many years ago, my mom was struggling with her mental health. She wanted an approach that looked at her as a whole person, not just her mind, but also her body, her stress, her hormones, her lifestyle, her spirituality. She wanted someone who would ask what could be contributing to these symptoms. But instead, she was prescribed 3 different psychiatric meds, and rather than feeling better, she actually started to feel worse. My mom experienced more depression, more anxiety, and even more panic attacks than she had before starting the medicine. When she told her psychiatrist that she wanted to come off of the meds, he was resistant. Eventually, he gave her a weaning protocol, but it wasn't personalized. It was way too fast. And because of that, my mom ended up in the emergency department with stroke-like symptoms that we later learned were withdrawal effects. That experience changed the course of my life. I had always wanted to be a medical doctor, but I knew that there had to be a better way than the conventional treatment that my mom had received. There had to be a way to provide compassionate, high-quality care that was both effective and holistic. And that's what led me to naturopathic medical school, and later to becoming a psychiatric nurse practitioner, where I could specialize even more in integrative psychiatry. Today, my mission is simple: to provide the kind of care that my mom needed all those years ago. Here's what that means in practice. I start with a comprehensive evaluation so I can really understand your history, your story, and your goals. I look at the whole person: physical, mental, spiritual, and social, because each of these areas affects your mental health. If medication is needed, I prescribe thoughtfully and with an emphasis on minimizing side effects. If you want to come off of meds, I specialize in supporting the body first to minimize the risk of symptoms coming back worse than before. And then I provide safe, step-by-step guidance to help you gradually and safely taper the meds in a way that's personalized to your body and to your unique needs. And whether it's through therapy, holistic strategies, or root cause approaches, my goal isn't limited to managing your symptoms. I want to help you move toward real healing and lasting resilience. If you've been looking for a mental health provider who will listen, who will respect your values, and who will see you as more than just a diagnosis, then I would love to walk alongside you. You don't have to do this alone. Let's go ahead and take that next step together toward the whole person care that you deserve.